All right, you're never too young to start thinking about your heart health. Perhaps starting early, you can actually avoid future problems with cardiac, like congestive heart failure for one thing. Dr. John Rommel is a cardiologist and congestive heart failure specialist with New Hanover Regional Medical Center. Thank you for being here, sir.
Thank you for having me.
Let's talk about congestive heart failure and what it really is.
So, you know, congestive heart failure is obviously a complicated disease. I think at its basis, the best way to talk about it is just it is the heart's inability to pump enough blood to meet the demands of the rest of the body.
Is that an umbrella term for all kinds of heart issues or no?
It's an umbrella term for a lot of different types within heart failure itself. A lot of people can get heart failure for a variety of different reasons. Most common being just people have a heart attack and the heart gets damaged, and therefore it's unable to pump as strongly as it used to, begins to weaken and dilate over time. But there are plenty of other causes that can lead to heart failure as well. You can get valvular disorders can lead to it, genetic conditions can lead to it, hypertension, diabetes.
I just had my blood pressure checked, 110/65.
Congrats.
Be proud of me.
I'm very proud of you. Well done.
Let's talk about, I just was at the doctor too recently, just kind of getting a checkup, and they talk about family history all the time, especially when it comes to heart disease. What role does that play in this?
It absolutely plays a role. We are learning more and more about genetic abnormalities that lead to heart failure every day. We're still in our infancy of understanding what to do with that information. You know, we're still learning how to process it, but it is important if you have family members with a history of heart failure to make sure you're talking to your doctors and to a cardiologist about if you need to be screened for heart failure and if you need to be treated for heart failure.
Diet and exercise, is that worth beating each other over the head with, or that's...
Absolutely. It's one of those things that's easy to say and hard to do, but it's definitely something not just for heart failure, but for coronary disease in general that we all need to be working on every day.
And very quickly, is there a quick warning sign that, uh-oh, I should go to the doctor?
It's not. A lot of the signs of heart failure can be very subtle. So I think you have to be paying attention and speaking closely with your general doctors, or if you have a cardiologist, if you're experiencing more fatigue or noticing swelling in your ankles, or even having trouble sleeping at night where you're waking up just gasping for breath. I think those are all signs of just talking to your physician and seeing if you need to be worked up for heart failure.
All right, we appreciate the tips, doctor. Thank you very much for being here.
Thank you very much. You have a good day.
All right, thanks. We're back in a moment.